Want to turn now to what is being called a major breakthrough in the fight against breast cancer. A new study shows that there could be a drug capable of preventing the disease in women who are at high risk of developing it. This could have a huge impact on millions of women. And of course, our GMA medical contributor, Dr. Marie Savard, is here to answer some of these questions. Good to see you. Thanks for coming in again. How important was this study? How big of a breakthrough, in your opinion, is this?
I think this is a really important study for women, and it just may lead the way to say that women could potentially prevent breast cancer. They took 4,500 women, postmenopausal women who had at least one additional risk factor for breast cancer, and after 3 years on a newer breast cancer drug, something called Aromasin versus placebo, they had a 65% reduction in breast cancer risk, and they had no serious side effects.
And we should note that there are similar drugs out there on the market right now, but they do have side effects.
Well, there are two older drugs that are from a different class, something called tamoxifen or raloxifene, typically called Avista. Both of those drugs have potentially lethal side effects that have scared women, everything from uterine cancer to blood clots to even stroke. And I think women and physicians have chosen not to use those drugs for the most part. This is a different drug, also lowers estrogen, but if the study holds up, if longer term and more studies shows the same thing, that it's safe and effective, this is really big news.
So who should look into taking this drug right now, watching at home?
Well, I think women who are postmenopausal, first of all, after menopause, who have an increased risk for breast cancer, should all talk to their physicians about what are the choices there today. And this is a drug, although not FDA approved for this use, is available. And again, if we have longer term studies to show that it's safe, and this study will continue, so we will continue to have more information, I think this is good news. So all women really need to ask the question of their physicians, is this right for them?
Is this right for me? But a big breakthrough nonetheless, very promising.
Absolutely,
discovery.
yes.
All right, Dr. Savard, we appreciate your time. Thanks for coming in.